So this abstract has been presented at ASCO a few weeks ago, and now is going to be presented at EHA now. And the topic is to look at the baseline ocular findings of patients who are receiving belamaf. As you know, the ocular tox is the leading adverse event in patients who are receiving Belantamab mafodotin. And this is a very frequent observation, but luckily the side effects are usually less intense, and it's reversible, and it can be maintained by dose modification. So, being elderly population, the myeloma patients are prone to have ocular baseline findings, and so the DREAM7 and DREAM8 studies were pulled together to look at the baseline ocular findings and to see the impact of belamaf administration if the adverse event is worsened during therapy. To our surprise, baseline ocular findings were very frequent in the DREAM7, which is 56%, and even more higher in the 71% in the DREAM8 study. The most frequent ocular finding was cataract, which is followed by other keratopathy, and dry eye as a third leading cause. And the others were less frequent findings. And so these are the side effects that we frequently observe under treatment. That's why it was very interesting. And the parameters that were included in the analysis were to look at the 20% change in points, visual acuity by patient exam, and also the corneal exam findings, and treatment emerging ocular adverse events were the third parameter. Looking at all those parameters, it was possible to see that in both DREAM7 and 8, the adverse event frequencies are almost identical, and it's also identical in patients who already have baseline ocular findings versus who do not have. So the additive value of the administration of belamaf did not impair the ocular adverse event, and treatment discontinuation was not different in between the arms either. So in conclusion, we can say that if a patient in real life in future has a baseline ocular finding, this does not prevent the patient from proceeding with a treatment that includes Belantamab mafodotin.